Okay, the topic under discussion is cardiomyopathy. Cardiomyopathy is nothing but heart muscle disease. Disease which occurred to the muscle of the heart. Okay, why it is occurred to the muscle of the heart? What does it does? Okay, what problem it makes to the heart? It makes the heart muscle not to pump the blood for the rest of the organs of the body. It makes the heart it makes the muscle of the heart harden. Okay, by making the muscle of the heart harden, the pumping of the blood doesn't allow to pump from the heart to the rest of the organs in the body. Okay, there is an abnormal muscle function. When there is an abnormal muscle function, automatically there will be an abnormal rhythm. Okay, the rhythm has been controlled by the electrical impulses. Okay, the first thing, there will be abnormal functioning in the muscle of the heart. Then after, there will be abnormal rhythm in the heart. Okay, the rhythm, what is the rhythm? S1, S2, and the pumping is the rhythm of the heart. Systole by diastole is the rhythm of the heart. The pumping is also noted as S1, S2 sounds. With the pumping only, the sound has been produced. No? Okay, by closure of the mitral valve and tricuspid valve, S1 sound is produced. By the closure of the edges of pulmonary and aortic valve edges, the second sound, S2 sound, dub is also produced. Okay, okay. These, the rhythmic, the notes has been controlled by the electrical stimuli. What are the, we can see two notes. What is SA node and also AV node? SA node is also sinoatrial node and also atrioventricular nodes. These nodes which helps the heart to pump the blood easily, and also it also helps to function the heart in a mechanical way. Okay. Sinoatrial node, atrioventricular node. These two nodes are in the control of electrical impulses. Electrical impulses will be taking control over these sinoatrial nodes and also atrioventricular nodes. Okay, when there is an abnormal functioning of sinoatrial node, there for the purpose of that, okay, when there is an irregular functioning of sinoatrial node, for sinoatrial node, artificial placement is done by the pacemaker. Okay, to function the sinoatrial node, the artificial placement is done, that is also called pacemaker. Okay. Next thing, we have till now we have studied regarding the cardiomyopathy meaning or definition. What is the definition? The heart muscle becomes very rigid and very hard, and also there is impossible and it is also very impossible to transport or to carry the blood from heart to different organs. Okay, there will be the abnormal functioning of the heart muscle and also abnormal rhythm in the heart. Okay, these two we can see. What are the symptoms? Symptoms: becoming chest very rigid, very tightening, and also having previous heart problems, previous heart attacks, previous heart fever, and also very illness, and also previous any health issues which are related to cause the major problem to the heart. Okay, means if there is any previous illness, if there is any chronic illness, that will make the heart to injure. Okay, further. Okay, because the infection will be spread by the body to blood, no, where the superior and inferior vena cava will carry the oxygenated blood. If you are having any puncture or any cellulitis or any infected wound in the lower limb, okay, the blood even is carried by the superior or inferior vena cava. Okay, inferior vena cava will carry the lower parts of the body, though then the deoxygenated blood at that side of wound will be carried exactly to the heart. No, by that the toxins will be entered, so infection will be carried to the heart. Okay, these symptoms we can see previous history of heart issues and also viral infections. These can make heart very affected. Okay, what are the causes? Viral illness, viral fever, cancer, and viral illness. Okay, these things can cause viral fever, cancer, viral illness, which makes heart very ill. Okay, these are the three main causes which makes heart muscle become so weak. Okay, by this, the next one we can see what are the diagnostic findings to find out the cardium has the affected with the infection. What investigations we can do? First prior we are going to do ECG, then after the troponin, because the troponin is a protein which has been produced when after heart is going to be damaged. Okay, is there any troponin level present in the heart is to be checked. Okay, then after if the troponin values are normal according to the normal value, the parameters are normal, then there is no troponin present in the heart blood vessels. Okay, next thing, if there is no troponin, then what is the reason? What might be the reason? Okay, next we are going to have chest x-ray. Okay, chest x-ray. Then after CT chest, by passing a radiation through the chest, okay, these radiation will also grasp the problem where there is. Okay, by also having a chest x-ray we can see the problem in the heart. Okay, CT chest, by CT chest we can know where there is the problem in the cardiac muscles, where the space is affected. By what heart muscle is affected? By infection, by viral infections, or any other toxins, or any previous history of heart, or any other liver or kidney problems may also make the heart becomes very weak. Okay, next thing, what are the diagnostic findings? ECG, chest x-ray, 2D echo, all this has CT, all this has been happened. Okay, to see the affected part, keen angiogram will be done. Okay, in the CT even you can know, but directly you can send a gauge wire or a catheter to the affected part, and how much it is affected, how much portion it is affected, you can see keenly in the angiogram. Okay, next thing, what procedures are necessary? What is the treatment? How we can prevent, overcome this cardiomyopathy? If someone's heart is affected with cardiomyopathy, okay, how will you know? Being a nurse, how will you know? What is the main thing? First thing, you will be notified that the patient is having chest pain. Then after sweatings. Then after increased or decreased abnormal rhythm of heart rate, means tachycardia, it may be bradycardia. You can hear the sounds as murmuring. Murmuring means there is no normal rhythm and normal sounds. Lub-dub is not produced by the heart. Those lub-dub sounds are murmured, as heard as murmured. Okay, overlapping the sounds one by one, we can hear those sounds as murmured. Okay, next one, what are the procedures? What is the treatment? What is the management? Surgical, medical, and also nursing management to be taken to overcome this problem. Okay, we'll be going on seeing this. Okay, next one, diagnostic findings has been done. What is the next one? Next one is what blood test has been done. Through the findings of that, through the findings of those parameters, we are going for a head. Okay, to these, if there is the causes, the symptoms may be depending upon the severity of the disease. Okay, for few people there will be tachycardia and bradycardia, for few people there will be fatigue, for few people there will be fainting, but there is a unique thing which it is, tightening of chest, and also severe chest pain, and also fever, viral infection, fevers. Okay, those are the common in all. Next thing, what procedures can we make? Medical, surgical and nursing management. In medical management, is it curable with treatment, medication? Is it curable with surgeries? We are going to be discussed. Okay, the procedures, two things are necessary here for cardiomyopathy, because a plague or an infection or a hardened clots which are affected, because if a clot is there, okay, medication has been given but the clot has not been diluted, for being a more period of time, that clot becomes toxin. Okay, becoming toxin, the affected clot will also affect the artery which is present in the clot is present in the artery, being at side. After for a few days, it also, if there is no treatment, okay, if the treatment, even after giving, if the treatment is not suitable for that clot, then after the clot also becomes toxic. Okay, what is the formation build up? It may be plague or it may be clots. Okay, next thing, cardiac catheterization is important. Cardiac catheterization and revascularization. What is cardiac catheterization? We have seen prior in two topics, CAD and also heart attack. Okay, cardiac catheterization is nothing but sending a balloon and also a wire gauge and also a wire stent through a gauge. Okay, and also putting a stent there at a affected portion can make the, see, this is the affected part with plague. Here you can see 100% flowing of blood. This is the affected part. There is only 20% of obstruction. Here you can see 100% flow of blood. Something is obstructed, no? Here there is 100% flow. Then there is, after coming to the down, there is lower of flow, decreasing the flow. Then after this obstruction, which is making the blood to flow very slow, means by that heartbeat also becomes very slow, the rhythm also becomes very slow. Okay, this is the part of heart. See here how the stenting, catheterization is done, and also how the balloon and also a stent is inserted in the affected part of the artery. Okay, the wire gauge is, this is a catheter sent through the artery, radial artery, and the affected part